Yeah, this is sure a surprise, not. The Daily Mail just put this up tonight, and I thought I'd share it. But it's like, yeah, well, no shit, Sherlock. It's medical, it's not just medical experiments, experimental medicine. It's quackery. Okay, the whole thing's quackery. It should be against the law across the board. Not just for minors, but people of all ages. It should not be allowed. It should absolutely not be allowed. Nobody changes sex. You just deal with it. Just deal with the fact that if you're unhappy because you think you can't perform stereotypical behavior of the opposite sex, then get help for it. As far as I'm concerned, those stereotypes are bullshit and shouldn't even exist in the first place. Okay. So, anyway, this is what they have. And the article that I tried to look at is, it's under a paywall, and it's like a journal article, so you have to pay to read it. It just has an abstract. Anyway, more than half of these dudes who get castrated and amputated are in so much pain years later they need medical attention. And guess who benefits? Doctors and pharma, of course. These quacks. Up to a third of patients also struggled to use the toilet or suffered sexual issues 12 months after the operation, which these patients attempting to impersonate the opposite sex. They don't have a surgically constructed vagina. It's a hole. It's just a damn gap. It's a gash that leads to nowhere. And it's just a breeding ground for all kinds of shit. Like hair and just all kinds of infections. Oh, God. I mean, I've heard it and I've seen it. You've read articles about how nasty that stuff is. Oh, Christ. They're not vaginas. So let's not call it vaginoplasty, which I'm trying to spit that word out, or reconstruction, because they don't have vaginoplasty. There's no such thing, because you don't have a vagina. You're just a dude with a hole in where the dick used to be, or near where the dick was, or is, whatever. I don't care. But anyway, here are the reported symptoms. And so most have pain and the dilation-related concern. Look at this. Bleeding, sexual function concerns, discharge, scar healing. I'm going to call it by its right name because they don't have vaginas. Okay? They just have discharge and they have healing of the wound. Urinary issues, look at that, 22%. Wound healing issue, because there are wounds. Aesthetic dissatisfaction. Well, yeah. Hair in the hole, 12.5%. Anatomic irregularity. Mental health concerns, probably 100% on that, because you're fucked up to even do it anyway. Loss of depth. Malodor, look at that. Closure, numbness, and dryness. And they keep calling that shit vaginal. They don't have a vagina. It's just a damn wound that had no business being opened up. And that's 80 patients. Some patients reported more than one complaint. And so it was 80 patients. Research in October indicated the number of is it research or what the hell is it called? Yeah, that's what the name of it is. And that's the thing you have to pay to get in. It indicated the number of patients going under the knife increased more than 150-fold between 2010 and 2018. Lots of money in it. Nobody has ethics. And this is Trinidad. And all 80 patients had the original quack procedure outside of the women's college health system, outside of it, but were experienced symptoms that needed follow-up care. Some had traveled as far as India and Thailand to have the operations, which the researchers say may explain the relatively high number of medical complaints. They're all going to be that way. Sooner or later, it's going to be a mess because it's not supposed to happen. Severe side effects were much rarer, but in 12 cases, or 15%, patients experienced... now, there's no such thing as vaginal stenosis because they don't have... These men don't have vaginas. It's just that it's closing up. The wound's closing up. Difficulty urinating, 22%. Sexual problems, 33%. And poorly healing wounds, which is all of it, 100%. They're all trying to heal. A total of 15 patients also told the clinic they were dissatisfied with the appearance of their new vulva and wanted some cosmetic revision. They don't even know what it... Ah, God. Oh, this is horrible. And this shit is legal. And they have a list of how many, and who knows how true this is. And this was in 2020, how many screwed up people there are in the United States. Supposedly there's 1,337,100 transvestites and others in the country. And how is it that 102,000 are there? More than there are out west or in the Northeast. I don't get that. But anyway, that's the map of it. And then they call it bottom surgeries. It's all mutilation. And this is the women thinking they're men, trying to pretend they're guys. It's quite clear for the most up-to-date studies that these genital surgeries don't work in the way that people hope they will. Yeah, of course they won't. And the reason there are so many, that's Stella O'Malley, the reason there are so many problems is that this is an incredibly difficult surgery. It's quackery. It's total quackery. You can't change sex. What you need is a shrink who's ethical. And will tell you, you can't change it. You got to deal with it. And that's the way it is. You know? Nothing is going to... You have the body you have, and you're not born in the wrong body. And then they talk about this guy that detransitioned, which, again, there's no such thing. I want to call it like the cultists, deprogrammed. That's really more what they are. They're deprogrammed rather than detransitioned. They're being deprogrammed from the cult. And he's had a lot of problems. And he's not afraid to speak out. The latest study was published in the journal, whatever it is, and that. So I think it's this thing here that I tried to get in. Maybe not. Maybe this is a different one. Yeah, it's another one of these you can... Oh, it does have the full text here. Okay. No, it doesn't. Nah, it costs $15. I'm not going to pay that. Anyhow, so I thought I'd just throw this out here. That this is no shit Sherlock. It's rather a long article for the Daily Mail. And it's just... They said here this... it's not vaginoplasty. There's no such thing in a man. But it's a particularly invasive procedure requiring surgery in which the penis and testicles are removed. In other words, it's castration and amputation. And a fake, whatever it is, a hole is created. A wound. And And this is kind of, it's hard even to describe this because it's terrible what's being done here. It's quackery. Absolutely horrible. It doesn't work. But anyway, I thought I'd share this. I wasn't planning to be on here very long, but you expect to see a lot more of these kind of articles in the media. Although this one, it's the Daily Mail, so it's not really mainstream. But more and more, it's just going to be more and more publicized, and moves should be made to outlaw it. Because yes, these people do need to be saved from themselves, because they're not all there mentally to begin with. Anyway, that's it.